Bloodborne pathogens are disease-causing microorganisms in blood and other potentially infectious body fluids. The hepatitis B virus, hepatitis C virus, and human immunodeficiency virus are examples of bloodborne pathogens. These viruses can be passed on to others and can cause serious illness or death. What is hepatitis B? Hepatitis B is a liver disease caused by the hepatitis B virus. Hepatitis B, formerly called serum hepatitis, is a life-threatening bloodborne pathogen and a major risk to employees in jobs where there is exposure to blood and other potentially infectious material. Hepatitis, which means inflammation of the liver, can be caused by drugs, toxins, autoimmune disease, and infectious agents, including viruses. What is hepatitis C? Hepatitis C is a liver disease caused by the hepatitis C virus. It is the most common chronic bloodborne infection in the United States and is primarily transmitted through large or repeated direct percutaneous exposures to blood. Most people who are chronically infected are not aware of their infection because they are not clinically ill. Infected people can infect others and are at risk for chronic liver disease or other HCV-related chronic diseases. Currently, there is no vaccine against hepatitis C. Universal precautions must be observed when there is a chance of exposure to bloodborne pathogens. This method of infection control requires the employer and employee to assume that all human blood and specified human bodily fluids are infectious for HIV, HBV, and other bloodborne pathogens. Where differentiation between types of bodily fluids is difficult or impossible, all bodily fluids are to be considered potentially infectious. Bloodborne pathogens can enter your body through exposure to blood or other potentially infectious bodily fluids. Exposure may occur through your mucous membranes, including your eyes, nose, mouth, or through an opening in your skin if you are splashed with blood or other potentially infectious bodily fluids, or by being stuck with a contaminated needle or sharp object. Providing first aid puts you at risk of exposure to bloodborne pathogens. It is very important to wear appropriate personal protective equipment to decrease this risk. Bloodborne pathogens must find a direct route of entry into the body for infection to be possible. Bodily fluids can also splash into the eyes and cause infection. Exchange of these bodily fluids must be direct. Thus, you cannot contract a bloodborne pathogen disease when an infected person touches you or sneezes or coughs on you. If your job or volunteer activities have the potential of exposure to blood or other potentially infectious bodily fluids, the following information will help you protect yourself. Here are some tips on how to stay safe when you come in contact with another person's blood or other potentially infectious bodily fluids. If you help someone who is bleeding, or if you are potentially exposed to blood or other potentially infectious bodily fluids, you must wear personal protective equipment such as gloves, a gown, and goggles or a face shield. Employers must provide you with appropriate personal protective equipment free of charge. If blood or other potentially infectious bodily fluids is on your gloves, dispose of the gloves properly by putting them in a biohazard waste bag. If you do not have a biohazard waste bag, put the gloves into a plastic bag that can be sealed before you dispose of it. Always wash your hands with soap and running water after you remove and dispose of the gloves. When removing disposable gloves, remember, roll the first glove off of the hand inside out. It is essential that you quickly and completely clean up any blood or other potentially infectious bodily fluids with soap and water to limit the chance of exposing your coworkers to bloodborne pathogens. Hands are the most likely areas to be exposed to blood or other potentially infectious bodily fluids. If you wash your hands with soap and running water after contact with blood or other potentially infectious bodily fluids, you greatly reduce your chance of becoming sick or spreading germs to others. It is very important that you report any exposures to blood or other potentially infectious bodily fluids to your supervisor. Reporting all exposures helps you get treatment and helps your employer identify and reduce causes of exposure. If you are stuck by a needle or other sharp, or get blood or other potentially infectious materials in your eye, nose, mouth, or on broken skin, immediately flood the exposed area with water and clean any wound with soap and water or a skin disinfectant if available. Report this immediately to your employer and seek immediate medical attention. How will you use a combination of engineering, administrative, and personal protective equipment controls to ensure the protection against bloodborne pathogens in your work area? Engineering controls are the primary means of eliminating or minimizing employee exposure. Administrative controls is second in line by providing proper task training for work areas, tools, and equipment. The use of personal protective equipment and clothing is the third element in this combination of providing protection against bloodborne pathogens.